I'd like to introduce Chris from Taiwan, and Chris has Sjogren's syndrome. Welcome, Chris.
Yes, thanks for having me.
Thank you. Could you describe what Sjogren's is for us, please?
Sjogren is a disorder of the immune system, often defined by two most common symptoms like dry eyes and a dry mouth, and which, is exactly what I have.
When were you first troubled with these symptoms?
I was first diagnosed in September 2007.
How old were you at the time?
I was just past my 42nd birthday.
So how did that impact on your life?
I was very healthy and I led a very active family life. I loved traveling. When I suddenly came down with this disease, it just made my life very difficult, made simple tasks very difficult because the eyes were just burning, painful every single day. I used to walk in big shopping malls with an ice pack over my eyes because I just couldn't keep it open. I couldn't travel. It was very difficult to travel by air, especially with the cabin air. Being in a very tropical climate, I was constantly using air conditioning, and the AC was just horrible on the eyes, causes a lot of burning. So it was very difficult. And my boy was only 6 years old. So I couldn't do a lot of the outdoor activities with him. So that frustrated me very, very much. So I was terrified and obviously very scared because I didn't know much about this disease and I couldn't find any help anywhere. So it was pretty scary and I became very depressed actually.
What sort of medication are you routinely given for Sjogren's?
Actually, I didn't know I had Sjogren's at first because my first symptom was the dry eyes, which came on very suddenly. So I was looking at how to treat my dry eyes. And the thing is, I did have occasional dry eyes before, so I always thought it was a dry eye caused by excessive use of contacts or just age, hormonal change, or whatever. So I just went the usual route. I went to see eye doctors, and they just told me that, you just had an excessive dried eye than normal. They just gave me eye drops. I knew something was wrong, but I just couldn't pinpoint it. And it's only after about 7 months into my dryness, my dry mouth, and it was very sudden as well. It was like an overnight thing, and my mouth just became dry. No saliva whatsoever, and my gums were sticking to my lips. It was just horrible, it made swallowing even very hard. So that was a terrifying experience because you didn't know what was going on. But throughout my research, I found, the symptoms resembling to this autoimmune disease called Sjogren's. So I knew I possibly had it, And I made an appointment to see my rheumatologist, and he confirmed the likelihood that I have Sjogren's.
So you say you're a rheumatologist. Do you have rheumatoid type problems as well?
I don't think so. I did have a little bit of aches and pains, but I didn't associate it with Sjogren's per se because the two primary symptoms that I have that really trouble me, that causes problems for me, were the dry eyes and then dry mouth. But so what happened was that, after I started to have a dry mouth as well, I started finding other little side effects. I would have little pins and needles sensations in my upper body. I would have this, heat or this burning sensation in my upper torso, which I couldn't explain. It's like something burning inside of my body. But when I touch my skin on the outside, I don't sense any fever or anything, but it was just something from the inside.
That is exactly the same as I had with MS.
Really?
The burning and the tingling, yes.
Yeah, the tingling. And I would have, like one night in particular, I started to have little jerks and little spasms in my legs, and that really frightened me because I, knew more about this disease, and that scared me because that seems to indicate that my disease is like progressing in some way.
Mhm.
So, that was something that just, totally scared the hell out of me.
So, what course of action did the rheumatologist take after he diagnosed you?
He didn't really do much. He suggested, the normal course of action, which is like eye drops for your eyes. There is this medication that helps secretion of the saliva. But you know what? I read everything. I mean, I did a lot of study after I suspected what I had, and nothing in all my research indicated anything or any medication that was supposedly able to treat it. Everything was more palliative type of action,
Mhm.
making you a little bit more comfortable.
Yes.
But I even joined the Sjogren's World Society and I joined the discussion. And those discussions just frightened me more because all I saw was
Mm.
people taking Plaquenil, or whatever medication they were taking. But still, everybody's disease were still progressing. And the worst of all is that people seems to be getting more autoimmune disease one after another. So I just didn't believe that is the right course for me.
Mhm.
And that's why I started searching and searching. And finally I came up, with something that seems to shed some light and that gave me hope, which was the LDN.
Mhm. How easy was it to obtain LDN?
Actually, it was not hard. Well, it's because the situation is a little bit different for me. In fact, I believe I was the only one in the country who knew about LDN. After reading all that, I just didn't think, my doctors would understand it, because it's just something just out of the ordinary, it's against all conventional knowledge, right?
Mm.
So I decided to ask, I met two patients who have Sjogren's like me in the United States through internet. I immediately asked them, about their experiences with LDN, and they had great success. So that gave me a lot of encouragement. So I decided to just go ahead. So I went on the net and I bought my medication through the internet pharmacy. And after about 14 days or so, I got my medication, and I just used the dilution method, and I just start taking it.
So,
Yeah.
when did you start taking it?
I started taking it November 27th of 2007.
Oh,
So it's over 3.5 years now.
so what were the first things you noticed? Did you have any side effects initially or anything?
Initially, I had a rash. I remember clearly. I had an unusual rash on my thigh, which I didn't think much about. But afterwards, I realized what it was, was just some kind of yeast infection. So I started having rash, but it went away. But 4 months after that, well, then again, let me backtrack a little bit. I immediately saw results in about 8 days.
Mm-hmm.
My saliva came back in 8 days, short days. And I was, I almost broke down and cried because I just couldn't believe it. And then my eyes improved, even though the improvement in my tear film production wasn't as dramatic as my saliva. I didn't have any problems with sleep or vivid dreams, but I did have a rash on my thigh in the beginning. I had some headaches and anxiety, but after about 4 months of taking LDN at 4.5 milligrams every night, I developed a reoccurring urinary tract infection that just wouldn't go away.
Oh.
And my LDN began to fail as well because the LDN benefits that I had experienced were wiped out. I had a case of candida overgrowth. So I immediately treated with, a strict diet and antifungal medications, and LDN began to work again.
Mm-hmm.
But after another 7 months, LDN failed me again when I found out that it was a matter of LDN buildup in my body. So I experimented with lower dosage and I skipped a few nights, and now it has performed more consistently and I'm still able to enjoy the benefits of LDN. So my eyes and saliva are actually much, much better than I first started. So, having this candida overgrowth actually was the best thing that ever happened to me, because the one extra benefit that I received was, apart from not having a lot of colds, was that it greatly reduced the overall anxiety that I felt. Because prior to my onset of Sjogren's, I was suffering from anxiety disorder, and I also actually had agoraphobia. And I continued the diet for about almost 2 years on a very strict one, the no soy, no gluten, no sugar, no starch, basically what you call the caveman's diet I took for close to 2 years, alongside with the antifungal medications. It greatly reduced my anxiety. I had my agoraphobic, sensation was practically wiped out. So that was a good thing. So I was very glad to have found out that my yeast problem, which I probably had for a long time, actually caused all these problems for me. So I'm very, very glad that I went through all that, so that's why I'm continue with my diet, and I do my maintenance dosage of antifungal medication every 3 months.
So how would you say your life is now? Would you say it's more or less back to how it should be?
Well, not quite, but it's very close. LDN is the best thing that ever happened to me. I have great relief from my symptoms, and I have hopes again, because I believe LDN stopped my Sjogren's from progressing and possibly even prevented any other autoimmune diseases from developing. So overall speaking, I am just a happier and healthier person.
So the forum that you used to speak on, that you mentioned,
right.
Have you told others about LDN?
Yes, I have. I have in the past. But, I actually participated in 2 different forums. One is the dry forum. Some of our, us who are suffering from Sjogren's tend to also participate in that, because that talk about the dry eye problems. I spoke about it immediately after I started trying my LDN. Some people tried it, but I haven't really followed up on that. I know some people tried it, and some people not seeing the exact effects that I have. So I guess it's still very, very personal. The Sjogren Forum, which I participated, I also have other friends who I know used LDN, also contributed. But it's this kind of topics come and go. So I don't necessarily go back constantly to keep on reminding people, because it is a very personal thing.
Yes.
And a lot of people are still very skeptics about it. They kept on saying it's not FDA, in terms of the treatment, it's not being acknowledged by doctors or whatever. So, it's not something that I would want to pressure people into trying. But all I can do is just share the great benefits that I have received. I consider myself to be very lucky. That's all I can say. I just hope that they keep an open mind, and I try to direct them into the right materials or the right forums that they can participate for themselves, so they can get the same benefit, or at least ask the questions that they need to ask and have them answered by people who have tried it, or doctors who have been using and prescribing it, that can give them the right advice. I guess that's the extent that I can do. But I always offer my help. If people want to write me privately, they want to email me or whatever, I always try to answer them as much as I can. And that's the extent of help that I can give.
So if people contact us and would like to have their messages sent on to you, you would agree to that?
That's no problem at all. I welcome it, actually, because one thing that sort of made me stay away from these forums sometimes is because I have received great relief from LDN. And it pains me to see other people who are still searching out there and who are still not getting relief, and then who are just seeing their disease deteriorate. That's just very painful for me, to think that, I am the lucky one, and I don't, and frustrate me because I don't know what else I can do. I welcome anybody who just want to have somebody to talk to or share experiences with. So if you have anybody who is interested in, LD and specifically for Sjogren's, I mean, go ahead. I don't mind sharing my experience with them so we can all learn.
Well, that's fantastic. Well, thank you very much for sharing your story with us, Chris. Really do appreciate it.